every case of HIV infection, on average, costs the taxpayer about $500,000 of medical costs.
That was the BC Dr. Evan Wood on the exorbitant costs associated with the spread of HIV/AIDS. This comes from a panel of international experts, including the likes of Richard Branson, Louise Arbour, who suggest that the global war on drugs is proving to be a very costly failure. They argue it's fueling an HIV epidemic. As I say, the former Supreme Court Justice Louise Arbour is among the authors, along with 6 former presidents and British business magnate Richard Branson. Now, some countries are rethinking their tough on drug policy, the so-called war on drugs. Canada, though, may be going another way. Are tougher laws and strict enforcement really the best way to eradicate drugs, or is more treatment and prevention? And as Dr. Evan Wood said to us, legalizing marijuana, is that the answer? Carrie Lynn Finley is the Parliamentary Secretary for the Minister of Justice. She's doing double duty today, so you get a double thanks there. She's alongside Vancouver's Libby Davies, the NDP Deputy Leader and the party's health critic. Good to see you, Libby Davies.
Hi.
And with me in Ottawa, Liberal health critic Hedy Fry, who I just saw actually in Vancouver. Good to see you. Carrie Lynn Finley, this report says that the war on drugs has failed. Dr. Evan Wood said that the Conservatives' policy vis-a-vis drugs, locking up users and treating them as criminals rather than addicts who need medical help, ends up costing taxpayers in the long run. What's your response?
Well, we have our national anti-drug strategy is not just one element. It's 3 elements: prevention, treatment, and enforcement. He's zeroing in on one aspect of that, but we fund and we have programs for youth and adults that for prevention, we have them for treatment, and we have increased funding for that because we want to help those who are addicted to drugs, and then enforcement. And on the enforcement side, we're not going after people for simple possession and that sort of thing. What we have aimed at in C10, for example, is those who are part of organized crime, who use the proceeds of illicit drug trade for the currency of organized crime, and those who are violent.
All right, let me, C10 by the way, but it does lower the limit, the 6 plant limit for incarceration. It used to be more. And the former Court Justice Louise Arbour, we spoke to her by telephone today. She's a contributor to this report. She was in London. Here's what she had to say about the 40-year war on drugs and where it's got us.
A policy that may appear to have superficially a lot of public support or popular appeal because it's based on fear and ideology about right and wrong. But in the end, we've been 40 years on this war on drugs scenario worldwide, and all the evidence demonstrates that not only it didn't make anything better, made a lot of things worse.
Libby Davies, time to rethink Canada's policy vis-a-vis drugs?
Oh, it's long overdue. First of all, it's a terrific report that's come out, Evan, from the Global Commission on Drugs, and I think they're speaking the absolute truth about the reality of the abysmal failure of the war on drugs, both economically, politically, and socially. Unfortunately, the Conservative government still doesn't get it, and it's very interesting to hear Carrie Lynn speak because, of course, what she's pointing out is that the Conservative government, when it rewrote Canada's drug policy, dropped harm reduction. There's only 3 pillars now, not 4 pillars. And so, you know, I just was visiting Insight today in my riding in East Vancouver. This was a small organization that had to fight all the way to the Supreme Court of Canada just to exist because they understand the safe injection site in East Vancouver, the only one in Canada thus far. And of course, the Supreme Court of Canada did rule in its favor, and we expect to see others in Canada. But to me, you know, it's just really well, I feel deeply saddened and somewhat angry that this government actually does not get the evidence and the reality that, first of all, the approach on the so-called war on drugs and criminalizing drug addiction is a failure, and that we have to have an approach that's based on health, that's based on health promotion, prevention, treatment, and as you heard from Thomas Wood, it's time for a debate about legalization.
But when Dr. Evan Wood was on the show, he also said, and you said that you like the report, it's time to legalize marijuana. All right. Would the NDP support that?
Well, in fact, at our convention years and years ago, we already have on the books a policy for decriminalization. We've also called for a very honest national debate about a more regulatory approach for marijuana for adult use. And, you know, I don't think that this is way out there anymore. Most of the public are way ahead of us, any opinion polls that are out there. So I think it's time to bring public policy in line with a sane policy on drug policy reform and not continue this insane war and criminalization of people who are using. I mean, it's costing us a lot. It's also costing lives.
All right, Hedy Fry wants to get in there.
Oh, I definitely want to get in there because I think it's interesting that, that we're talking about evidence. Because really, evidence tells us what works and what doesn't. Evidence shows us where something is harmful and where it isn't. So evidence is clear-cut fact. And why would we not use clear-cut fact and information and evidence based on looking at what other countries did to make our decisions on good public policy? It's ridiculous not to do so.
So what's your problem with the government's policy?
My problem with the government's policy is it's not evidence-based. My problem with the government's policy is that Carolyn said that they spend money on prevention, treatment, etc. Look, this government spent $454 million last year on the drug strategy. 93% of that was on enforcement. So that leaves about, 6.5% of it to do the treatment and the prevention and all of those other things. But what is missing here is the fact that, A, the addiction is a medical issue. Therefore, it should be dealt with public health principles and public health solutions, firstly, because what has happened with the war on drugs is that there are many harms that have occurred. First and foremost, we have an increase in HIV/AIDS. We have an increase in hepatitis C and A, which are infectious diseases that are spread by
But are you sure that is that caused by the war on drugs or is it caused by users?
No. It's caused because a lot of people are hiding to use drugs. They're not getting HIV treatment because of the stigma, because they're going to be picked up and criminalized. So they hide. They're in the underground. They're not going to get treatment. They're not coming out to do that. And British Columbia, in Canada alone, we can look at Portugal, where they have decriminalized all illicit drugs and now find that about 15 years later, they have brought down the use of drugs substantially.
Let me get Carolyn Finley wants to jump in. I mean, the report argues, Carolyn Finley, that we have increased incarceration rates. We've got increased HIV/AIDS rates. We're not really dealing with users there, addicts in the right way. And it's time to not just decriminalize, legalize and regulate marijuana use to cut out organized crime and to cut out the skyrocketing cost to our prison system by imprisoning these people. What's the argument against that?
Well, first of all, this is a complicated matter and there's different aspects to it. The Prime Minister himself has said that he doesn't think we're doing well in combating international drug cartels. We need better international cooperation. We need to rethink how we approach that. But domestically, we have a constitutional duty to keep our communities and our streets safe. And as part of that, we have a duty to not only help those who have addictions and who need that kind of help, but also to keep people safe from those who would do drugs or whatever do harm.
But Evan,
I want to I wanted to finish this comment. Libby mentions
Carolyn Finley, then Hedy. Sorry, then Carolyn Finley, and then we'll get Libby Davis and then Hedy Fry, real quick.
Libby mentions, for instance, the long-standing NDP policy, which, I understand what it is, and she's stated it well. But her own leader, Mr. Mulcair, has said, we want to take a look at this marijuana because the marijuana in the street today is far more potent than it used to be, and we have evidence that it may actually contribute to or create mental illness. That is a mature approach and one that makes a lot more sense to me than just saying, no, we just decriminalize it all, go for it.
But
we have streets and communities to keep safe.
I would like to respond to that because it's not just a decriminalization, legalization, it's about regulation, and that's why we need to move from what really has been a situation now of chaos and violence. I mean, for the Conservatives to talk about safety on the streets, I mean, my God, it's the drug wars and the gang wars fueled by drug dealing in Vancouver that's fueling lack of security and violence on the streets. So even from from that point of view, they should be recognizing that the present approach, the status quo, is an utter failure. So we do need to rethink these policies in Canada. Canada is now way behind the international community, and I think this report today should be cause for thought that we need to change direction and advocate for a different approach that isn't based on criminalization.
It's actually that we missed the point here. We're not talking about the legalization of marijuana or the decriminalization. The Liberal Party is clear. We will decriminalize, regulate and tax. It's as simple as that. What we're talking about, a report that came out today that says that the war on drugs, especially in opiates and intravenous drug users, has in fact created more harm than good. It's created a rise in HIV, hepatitis C rates. When you incarcerate people and they are in prisons, they miss taking their medication for HIV, so that the HIV increases. They have unsafe sex in the institutions. They therefore come out and they reseed into the population, HIV. We're talking about the fact that people are being killed all over this world right now in drug wars, and yet the supply of drugs is going up, the quality of drugs is going up, and we've seen a rise of about 380% in the amount of drugs available today globally. And what they're saying is, let us deal with it with medical principles. Let's look at this as a problem that's medicine. Let's bring in harm reduction principles. Let's look at the spread of disease. Let's treat this problem based on what we see working. And you just have to look at Portugal to see what works.
All right, I got to let it go there. Carolyn Finley, Libby Davis, and Hedy Fry. We'll continue this debate. It's a complicated debate. Very interesting. You're weighing in on this report, this international report out today. Thanks, all three of you.
Thank you.